You're listening to localwebradio.fm. Community-minded, locally focused.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert. Brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and I am your host today. And of course, I am here with Dr. Norm Ickert, director of the Ickert Dental Implant Centre, and today we'll be talking about some of the techniques involved with soft tissue grafting and why it's necessary. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. And Dr. Ickert, as always, it is great to be talking with you today.
Thank you, Nick. I'm looking forward to this session together with you.
In our last podcast, we talked about hard tissue grafting, or what is sometimes called bone grafting. But in this podcast, we're going to be talking about soft tissue grafting. And before we get ahead of ourselves, we should probably just quickly define what soft tissue grafting is.
Well, I think really simply said, think about when you graft a branch into a tree. It's basically taking another part, usually from the same person, and trying to graft it into another site and have it grow. Now, we'll talk later on that we don't always have to take a piece from the actual person, but basically you're trying to take a different piece of tissue and put it somewhere else where it might be deficient.
And so we're talking about gums, right?
Exactly. We're talking about the gum tissue that surrounds the tooth and the gum tissue that surrounds even the mucosa as it extends up into your lip and up into your cheek.
Okay, so then why is soft tissue grafting ever necessary instead of just waiting for something to grow?
Well, there are some basic reasons why we need the grafting, and one is we need additional gum at times for improved aesthetics. If you don't have enough gum, then whatever we put up against the gum won't look natural, so we need some extra volume. Or sometimes we need additional gum tissue just for the proper functioning of the entire complex. For example, the lip and the cheek have very, very thin tissue called mucosa, and it's very stretchy. But it's very, very thin, so it can be stretchy. Well, if you have that kind of gum tissue up against your tooth or up against your implant, it will almost be impossible for you to clean it because it's not robust or resilient enough to handle the cleaning, so you'll end up with tremendous inflammation. So for just basic function and health of the site, we have to graft gum tissue. And that is really important because if you don't have the ability to keep your implant tooth or your natural tooth clean with your normal hygiene protocols, whether it's at home or at the office, you can imagine it will be inflamed and it'll be uncomfortable.
Right.
And another reason we have to graft gum tissue sometimes is to prepare the site for future surgery. One of the principles that is cardinal to all surgery, whether it's in the mouth or the rest of the body, is to try and get what we call primary closure. We want the two pieces of tissue that have been incised at the end of the procedure to be able to be adapted so precisely together without any tension that it won't open up following the surgery and you'll get proper healing. And oftentimes when you've got deficient bone in the area and you have to graft new bone in that site, the gum isn't stretchy enough, or you don't have enough of the gum tissue to be able to close up the site once you've added the additional bone. And then the site will just open up and you'll lose your bone graft, or it'll be highly compromised. So oftentimes we actually graft soft tissue or gum before we even consider doing the hard tissue or the bone graft.
So there's a lot of different reasons that somebody might have to undergo a soft tissue grafting procedure.
Yeah, that's right, Nick. And it's sometimes a little bit undervalued or underrated, and we focus on the tooth and on the implant and all those things because that's really what people want. They certainly don't come to us for grafting procedures. People want a tooth. They want an outcome. They want function, aesthetics. But if we don't provide that tooth or that implant with the proper environment, and the gum tissue is such a critical part of that, there's going to be a less than ideal result.
In what ways? How is that going to play out? What are the less than ideal situations?
Several ways. One is just from an aesthetic standpoint, you're not going to have enough thickness of gum tissue so that when you try to put your crown or your tooth into that site, it's going to look like the tooth was just pasted on top of the gum rather than it actually looking like it's coming out of the gum tissue. Furthermore, the gum creates an important seal around the restoration, and if that seal isn't there, it's going to be a natural entry point for bacteria to creep between the restoration and the gum, and it can obviously go to the rest of the body through the bloodstream, and it'll create a very unhealthy situation. So gum tissue is like skin, and just like we have with the rest of our body, the skin protects our organs and the insides of our body, so the gum protects the tooth, and it protects it in terms of preventing bacteria and debris to get into the rest of the body. So the gum or the skin is extremely critical.
Okay, so we have all of these different reasons that we should perhaps consider undertaking a soft tissue grafting procedure, but why are we losing the gum in the first place?
Well, the best way to answer that, Nick, is just simply to go back to basic biology. And as we said in other podcasts, that once you lose the tooth, no matter who you are or what procedure gets done, you will lose a certain portion of the bone. That's a principle of biology that you cannot alter in any way. Right. So when you lose the bone, that means you're going to also lose the skin or the gum that's over top of it. So anytime a tooth is removed, you will by definition also have not only bone loss, but you'll also have gum loss. And then furthermore, when you lose a tooth, you also lose a very important organ, which is called the periodontal ligament, which is a buffer between the bone and the tooth. And when this important vital organ is lost, it will actually mean that you have less blood supply to the bone. And if you have less blood supply to the bone, you're going to get some shrinkage of the bone that way as well. So this is a totally physiological, biological process that we absolutely cannot get around once you lose a tooth.
Now, we've talked a little bit about this already, about volume and aesthetics, and you mentioned, that you want the tooth to make sure it's coming out of the gum, not just sort of pasted into the mouth. But is there a connection between creating volume from the gums and also making sure that the function of the tooth itself is that the tooth is functional? Absolutely.
I think it can be said that the more volume of soft tissue you have, the greater not only the aesthetics, but also the greater the comfort and the greater the function that you have around that area. So volume is extremely important.
And so what kind of functional issues are we confronting here? I mean, just that the tooth stays there and that you don't get sick?
Well, that's part of it, but what I tried to mention before was that when you have this very thin, elastic tissue on the inside of your lips and inside of your cheeks, which is called mucosa, it is so thin and friable because it has to be for the elasticity. But then as you get closer to the actual tooth itself, at the margin of the tooth, where the gum line is, we have a thick band of tissue called attached tissue. So in other words, when you eat, chew, and talk and have all this function, the lips and the cheeks don't pull the gum away from the actual tooth because you have this band of attached gum tissue, which is like this Band-Aid that prevents the pull away from the tooth. So it keeps the seal. And oftentimes when you lose a tooth and you lose the bone, this band of attached tissue is completely lost as well. And so now when you place your implant into that site, you don't have that protective seal around that. And that is extremely important for many, many people to reestablish that functional band of attached tissue. And that can oftentimes only be done with some type of soft tissue or gum graft procedure.
Okay, so there are a variety of different kinds of gum tissue. This is fascinating. Are there any others?
Well, it gets very, very complex, and we don't need to get into the intricacies of the different gum tissues that exist, but there are several different types of gum tissue that surround the tooth. On a natural tooth, the type of gum tissue that hugs the actual wall of the tooth, in that little pocket, you have about 3 different types of cellular configurations of gum tissue, and the cells of the gum tissue turn over extremely quickly. Every few days, you get brand new cells forming. It's like an immune system that you have around your tooth that continues to turn over and get rid of the bugs and get rid of the bacteria so that the site stays healthy. I mean, it's the only part of your body where something actually sticks through the skin. And so if that seal isn't very sound, you can imagine why you would get discomfort or abscesses or infections, and even as far as getting bacteria to go to other parts of your body and being potentially the cause of other major systemic diseases. So we have different types of gum tissue that surround the tooth. Then we have different types of gum tissue that extend down into the area of what we call the vestibule, which is at the bottom of the gum tissue, and as it rolls up into the cheek. And there are different types of gum tissue for different types of function, different types of purposes. And when we are missing some of these different qualities in our gum tissue, it affects the overall health and function of the entire system. And also, Nick, it's really important to note that there is a great variability amongst the population regarding the thickness of the gum tissue. In other words, you can divide people into either having thick gum tissue, genetically predetermined, or thin gum tissue. Now, unfortunately, the majority of the population is more on the thin side. And when you have thick gum tissue, it's amazing how much more robust the entire system is and how much more people adapt to different issues because that gum tissue is so thick. But that's really just a smaller percentage. I'd say probably less than 25% of the population has thick gum tissue. Most of us are more on the medium to thin side, and so there is a greater need for grafting. And it all comes down to how patients adapt. We're only trying to graft or add tissue to the patients who actually need it. Not everybody needs it. It depends on their natural biological genetic makeup.
Now, we have to take a quick break, but we'll be right back with Dr. Norm Ickert from the Ickert Dental Implant Centre. And when we return, we'll be continuing our conversation on soft tissue grafting. So don't go anywhere. We will be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
Take control of your financial future with sound investing with Byron Stryloff, Senior Investment Advisor and Chartered Financial Planner with over 30 years of experience on the Business Channel on localwebradio.fm.
Shopping for the lowest mortgage rate? Looking to refinance? Catch the Mortgage Newscast with Jared Dreyer on the Business Channel on localwebradio.fm. Buying or selling a home on the Semiahmoo Peninsula? Catch up on local market conditions on This Week in Real Estate with Lance and Connie Marples from Sutton West Coast Realty on localwebradio.fm. To schedule a face-to-face consultation, you can reach Lance and Connie at 604-538-8888. That's 604-538-8888. And visit them online at www.surreywhiterrockhomes.com.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, we are back with Dr. Norm Ickert, and we are continuing our conversation on soft tissue grafting and the different procedures that are available. And so we've talked about all the different kinds of gums, and we've talked about the need for soft tissue grafting, but what are some of the signs or symptoms that a person has when they don't have enough gum tissue where they need it?
Yeah, Nick, this is quite easy to identify. Usually it's pain just to normal function, such as chewing or speaking.